Hi, good afternoon everyone. My name is Roland Joey B. Labarca, and for now, I'm going to discuss about the diseases caused by smoking. So, smoking causes cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, which includes emphysema and chronic bronchitis. Smoking also increases the risk for tuberculosis, certain eye disease, and problems of the immune system, including rheumatoid arthritis. So first is cancer. Cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Cancer starts almost anywhere in the human bodies, which is made up of trillions of cells. So, why do cigarettes cause cancer? Because smoking can cause cancer and then block your body from fighting it. Because poison in cigarettes, poison in cigarette smoke weaken our immune system and our body, uh, making it harder to kill the cancer cells. So cigarette smoking causes cancer of the mouth and throat, esophagus, stomach, colon, rectum, liver, pancreas or voice box or larynx, trachea, bronchus, kidney and renal pelvis, urinary bladder, and cervix, and causes acute myeloid leukemia. Next is heart disease. Heart disease is a collection of diseases and conditions that cause cardiovascular problems. So how do cigarettes or smoking cause heart disease? The blood distributed in our body was contaminated by the smoke or cigarettes chemicals, which is that chemicals can damage our heart and blood vessels, which uh, which can lead us into have a cardiovascular disease or cardiovascular problems. Next is stroke. So stroke is a loss of brain function caused when blood flow within the brain is interrupted. Stroke can cause permanent brain damage and death. So, when you inhale cigarette smoke, carbon monoxide and nicotine enter in your bloodstream. And that carbon monoxide reduce the amount of oxygen in our blood. So, lisod na siya i-deliver throughout in our body. And the nicotine makes our your heartbeat faster and raises your blood pressure. So, just like for example uh, kanang tao nga kanang atakihon og high blood. So, if dili siya matabang dayon, it's possible jud na kanang mag-stroke o manggahi siya, lisod na siya glihok. And smoking or cigarette smoking is one of the reason why increases the risk of stroke to the human body. Next is smoking can cause lung disease by damaging airways and small air sacs or the alveoli found in our lungs. Lung disease caused by smoking include chronic obstructive pulmonary disease, which includes emphysema and chronic bronchitis. Cigarette smoking causes most cases of lung cancer. So, when people smoke, uh, it damage their lungs or their airways. Agianan sa hangin padto sa ato ang throughout our lungs. Pa-damage siya because of the chemicals from cigarettes, which is nicotine, carbon monoxide. So that's why uh, there are people na mag-experience og lung cancer, especially jud kanang mga smokers, no. They experience lung cancer. Next is diabetes. Nicotine increases your blood sugar levels and makes them harder to handle. People with diabetes who smoke often need larger doses of insulin to keep their blood sugar close to their target levels. So, may example na ako ani my grandmother or my lola. She has a diabetes before. Tung buhay pa siya. Even though nagatake iya lang ginatake ato dati kay kuan lang, everyday nagainom siya metformin, but lisod gihapon siya kayo it's hard to make it normal ang iyahang blood sugar. Nagataas gihapon kay everyday she makarot siya ganang 10 pataas yata na unsa na stick of cigarettes. Then lisod na kayo niabot sa point na iyang blood sugar kay taas na jud kaayo, then iyang tiil kay nagubag na, and then that time wala pa siya gina-insulin na to kay unsa na then that time wala pa siya gina-insulin, so ang iyang blood sugar ni taas jud antod na ang iyang tiil kay kanang nag-start na magsamad-samad. So para sa kwa one of the reason nga nung mas nilala ang iyang diabetes is because of cigarette pag smoke. Next is tuberculosis. So tuberculosis is a bacterial infection spread through inhaling tiny droplets from the cough or sneezes of an infected person. So how it affects nganong ang isa ka tao mag-smoke, magkaroon siya TB. So smoking damages the lungs and impacts the body immune system, making smoker more susceptible to TB infection. So ang pag-smoke, when people smoke, their immune system kanang hinay siya because ang lungs sa tao, ilang lungs ma-destroy po siya, madaot, so that magkaroon ng muhinay ang iyang immune system. So dali ra siyang kanang matakdan sa tao nga labi na kanang TB. Mao nang matakdan siya, mao nang magka-TB siya because ang iyang immune system hinay na, kanang lisod na mong fight para sa mga infected bacteria, no, musulod siyang lawas. That's why people who smoke magkaroon sila magka-TB sila. So lastly, certain smoking can cause a certain eye diseases. Study shows smoking increases the risk of age-related macular degeneration, cataracts, glaucoma, and diabetic retinopathy, and dry eye syndrome. So why smoking cause these certain eye diseases? Is because same lang yapon. It destroy the blood vessels in our eye because of the chemicals, no? Because of the chemicals nga naa sa cigarettes nga gina-smoke. So motong it's because mag-cause siya og certain eye diseases ang smoking. So that would be all. Thanks for listening and God bless.